Monday next week will mark 2 years since the first case of COVID-19 was identified in Africa. Since then, the continent has had 4 waves of the deadly pandemic. The WHO has hailed the continent for its robust reaction after every wave.
As we stand here today, we're finally able to say that if the current trends hold, there is light at the end of the tunnel. As long as we remain vigilant and we act intensively, particularly on vaccination, the continent is on track for controlling the pandemic.
The World Bank estimates that the COVID-19 pandemic pushed up to 40 million people in Africa into extreme poverty. Further, the bank estimates that every month of the delay in lifting containment measures cost Africa up to $13.8 billion in lost gross domestic product. This year, however, things are likely to change for the continent, which has over the last 2 years withered predictions of doom.
It's also been very difficult as a country, with our first case being diagnosed on the 5th of March 2020. We went to experience the highest variant of COVID-19 in the continent.
The pandemic has also seen the continent develop capacity in the health sector with an increase in trained healthcare personnel as well as medical equipment and the continent's ability to manufacture some of this equipment at home.
Going forward, when we move into the next so-called control phase of COVID-19 or living with COVID-19, the capacity of countries to reduce and control incidence of infection will be key.
With only 11% of the adult population fully vaccinated, the World Health Organization warns against letting the guard down, including continuing with testing. The Africa CDC, on the other hand, called on the continent's leadership to show political will and support local manufacturing of vaccines, therapeutics and diagnostics. Sarah Kimani, SABC News, Kenya.